It usually starts with shortness of breath, followed by a cough that won't go away, wheezing, chest pain, and constant fatigue. These are the early signs of emphysema, a type of lung disease that gets worse over time. And you can have it for years and not know it because the symptoms may gradually occur. Emphysema is irreversible, but treatments can help relieve the symptoms and slow the progression of the disease. And since it cannot be cured, prevention is your best approach. I'm Dr. Freddy Gomez. This is Med Talk Health Talk on CNN Philippines, where your healthcare comes first. Emphysema is a chronic lung condition that's caused by long-term exposure to airborne irritants such as tobacco smoke, air pollution, chemical fumes, as well as dust. It may also be caused by genetic factors. Joining us in today's discussion are Dr. Lenora Cañizares Fernandez. She's the Division Chief of Pulmonary Medicine at the UP Philippine General Hospital. We're also joined by Mr. Noel Tiburcio. He's a registered respiratory therapist and president of the Philippine Respiratory Care Professionals. Thank you both for being with us today. Now, you may have emphysema without even realizing it because it's a progressive type of disease. Dr. Lenny, can you tell us more about this?
About emphysema, we call it the loss of the attachment of the air sacs. So basically, at the end of our airways, we have the air sacs where the oxygen diffuses through. It becomes enlarged and the airways sort of collapse so that air is trapped. Right now, we have a modern term for it. We call it COPD, chronic obstructive pulmonary disease, because aside from those air sacs that are damaged, we also have the narrowing of the airways or the chronic bronchitis.
Okay, so now the umbrella term is COPD for this, but you mentioned about emphysema that belongs to this as well as chronic bronchitis, which are both lung conditions. But Dr. Lenny, is it possible for people to have both at the same time, emphysema and chronic bronchitis?
Both are present at the same time. And that's why we need not differentiate the two anymore because we have the same treatment for both illnesses. So that's why it's lumped now as COPD.
Okay, that's good to know. Now, one of the main causes of emphysema, or if not the main cause, is smoking, which makes it one of the most preventable type of respiratory diseases. Dr. Lenny, apart from smoking, what are some of the other causes that may lead one to have emphysema?
We've seen smoking, as I mentioned, is 90% of the cause. The 10% is due to non-smoking causes. And in the Philippines, we have seen that exposure, for example, to dust in their occupations and the use of biomass fuel. So when you now cook using coal and the wood fire, that can also predispose to COPD and emphysema. And the other thing we've noted here in the Philippines in our local study is that even tuberculosis by itself, with the damage that happens with it, can sometimes also lead to COPD. We have a nice term for it, TOPD, TB-related COPD.
Now, it's common for most people not to realize that they have emphysema until there's around 50% or more damage to the lung tissues. The main symptom, which is shortness of breath, which happens gradually. As the condition progresses, you will notice an increase in these symptoms. Mr. Noel, what are the other symptoms of emphysema that our viewers should be wary about?
Well, the most common symptoms na attributed dito ay coughing, then leading to increased mucus production, yung dumadaming plema, especially sa umaga. Yung shortness of breath, which is primarily yun ang makikita mo kagad sa isang pasyente na may emphysema, and then yung wheezing, respiration, and additionally, yung paninikip ng dibdib or tightness of chest.
Dr. Lenny, is there a certain time frame where these symptoms will become apparent to the one being affected?
Yes, Dr. Freddy, you mentioned this is a progressive disease, so it takes time. And we usually now suspect emphysema starting at the age of 40 years old. So that's when now we would consider COPD, because the other disease that can cause narrowing of the airways, shortness of breath, would be asthma. So we have to differentiate the two because the two are different. And we have the time, the age factor that we consider. So we now think of COPD, we suspect it when you're age 40 years old and above, you have persistent shortness of breath, and it's not related to a heart disease, for example. You have persistent coughing, then you suspect COPD.
Okay.
And emphysema and chronic bronchitis.
Now, if you have emphysema, your doctor will most likely diagnose your condition as COPD, which is an umbrella term for lung diseases that develop over time. When we come back, we'll talk more about how emphysema is diagnosed. You're watching MedTalk Health Talk on CNN Philippines. The outlook for people with emphysema depends on how bad the condition is and how early they start treatment. We're Together in Health. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. Your chest feels tight and you're out of breath. Is this emphysema? You can't just really rely on symptoms. You have to see a doctor to make sure. Dr. Lenny, how is emphysema diagnosed?
We do the lung function test or pulmonary function test, or what we call spirometry. You blow into a machine and we see how much volume of air you're able to put out. So the lesser the volume, we now suspect that there is emphysema or COPD or chronic bronchitis.
Dr. Lenny, aside from the spirometry, how about high-resolution CT scans? Will these be part of your test as well?
We can request for that, but it's quite expensive, and it is not the confirmatory test actually for emphysema or COPD. We like to do it because we do see the enlargement of the air sacs there, but it is not absolutely necessary to make the diagnosis.
Now, if you're used to having your blood drawn through your vein, your pulmonologist or your doctor may require an arterial blood gas in order to diagnose emphysema, which is a different and a little bit more tricky type of blood drawing. Dr. Lenny, how does this work, and what type of information is vital for you in diagnosing emphysema here?
We have the respiratory therapist get blood from your artery, and then we check how much oxygen you have there and carbon dioxide. Remember, our lungs would function to get in air and then to blow off the carbon dioxide. So if you get low levels of your oxygen and then high levels of your carbon dioxide, that can confirm now actually a severe kind of emphysema or COPD. We don't need to reach those levels for us to make the diagnosis. And if it's present, then that would really be a bad sign of a more severe kind of emphysema.
I'll ask that question then to Mr. Noel. How important is getting a arterial blood gas in order to really see the total picture of the patient?
The ABG is going to reflect the gas exchange ng pasyente sa dugo. Okay? Yung pumapasok na oxygen at yung lumalabas na CO2. Because one of the characteristics ng isang emphysema patient is mataas ang CO2. Kaya doon malalaman na kaagad kung ang isang pasyente is possible na magkaroon ng diagnosis na emphysema with a high CO2.
Okay, so importante talaga itong mga tests na to. Now, emphysema occurs slowly in stages, usually due to years of smoking cigarettes or other types of tobacco. And the stage is determined by looking at your symptoms and the results of the breathing tests. Now, Mr. Noel, let's discuss the stages naman of emphysema.
Actually, there are 4 stages of emphysema. We have stage 1, which is considered mild, and then we have stage 2, which is considered moderate, and then stage 3, which is severe, and then stage 4, which is very severe. So ito na yung end stage ng emphysema, yung stage 4 natin. Sa stage 1, doon hindi pa natin masyadong hindi alam ng pasyente na or ng person na may suspected siya na emphysema.
Mr. Noel, with that, ayaw siyempre natin umabot ng stage 4. No? Will quitting smoking benefit a person with emphysema who is in any of the stages that you mentioned?
Mas maaga na tumigil sa paninigarilyo ang isang tao mas maganda. Medyo mag-i-improve ang kanyang lung function at ang progression ng disease medyo titigil na. Yun lang. Kaya nga, ang aming, as a respiratory therapist, yung smoking cessation program ang aming ini-endorse para matigil ang pasyente sa paninigarilyo, which is the main cause of emphysema.
Yes, and if left untreated, emphysema can develop into serious complications, which of course ayaw natin mangyari. Dr. Lenny, can you explain to us what are these severe conditions and symptoms?
The first stage would be, as mentioned by Dr. Noel, stage 4, and this would lead to very low oxygen. You would need oxygen the whole time. And the other very bad side effect would be the right side of the heart can fail, and we call it cor pulmonale because of the low oxygen, so that the patient now would manifest with swelling. They would become bluish in their nails. They would be cyanotic, and they would persistently be short of breath.
Mr. Noel, even if the patient is surviving and alive at stage 4, what kind of quality of life can we expect to see at this stage?
Yeah, at this stage 4, the severe stage of emphysema, mababa na talaga yung quality of life. At saka most common, yung mga activities of daily living, hindi na niya talaga makakayang gawing mag-isa. Kailangan na niya ng assistant or help from the family or from the caregiver. Kaya ito na yung like what Dr. Lenny has mentioned, na naapekto na yung right side of the heart, yung right heart failure, which we call cor pulmonale. So yun ang pinakamalala na stage ng emphysema.
Okay. Ito na rin ba, Mr. Noel, ang stage where we might see the patient need to carry an oxygen tank wherever they may go? So may nakakabit na O2 cannula with them as well.
So ito yung kahit na konting movement ng pasyente, ay nahihirapan na siyang huminga. And the only thing that can alleviate that shortness of breath is an oxygen therapy. Kaya continuous na nasal cannula sila, though on a low liter flow, like mga 1 to 2 lang. Pero yon, hindi na sila makagalaw kung walang oxygen na nakasuot sa kanilang sa ilong.
Yes, this is why we are telling this to our viewers, because emphysema can be easily prevented. More on this when we come back. You're watching Med Talk Health Talk on CNN Philippines. If you have emphysema, you can take a number of steps to slow its progression and avoid complications. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines. So how do we prevent emphysema? Of course, don't smoke. If you're around a smoker, stay away to avoid breathing secondhand smoke. Dr. Lenny, are there any other preventive advice that you can share with us, especially those who are around or who have a loved one who does smoke, but they don't smoke themselves?
Well, the best way would really to ask your loved one to stop smoking. Otherwise, you can you can be away from the smoker, and basically that's it, because you really shouldn't be exposed to them. Even the vapors too, because there's a 6 times increased possibility that you can have asthma or emphysema if you're around vapors as well.
Mr. Noel, if you already have it, if you already have emphysema in the earlier stages, is there a way that you could prevent further complications or further progression?
The only thing or the easiest way is to stop smoking, or convince someone na tumigil ng paninigarilyo, because at the end of the day, ito pa rin ang talagang #1 cause ng emphysema.
Okay. Now, emphysema can't be cured, but treatments can relieve its symptoms, treat complications, as well as minimize disability. Dr. Lenny, please tell us more about these treatments.
We have inhalers. We use this. I have it here in my clinic right now, like this one or this one. These are inhalers that can open the airways and lessen the shortness of breath of our patients. Now, some studies will show that if you give it early, sometimes because with the persistent airway opening, it might really ameliorate or lessen the symptoms very much and might even lessen the inflammation in the airways too. So the medications are there to help in the symptoms, but still bottom line, whatever was the irritating substance that caused the emphysema, shy away from it or get rid of it. So like smoking.
Yes, and a reminder, if ever there is medications, don't self-medicate at home. Always see your doctor or your pulmonologist before taking any medications. Now, Mr. Noel, what types of therapy are available to people with emphysema?
Sa ngayon, ang medyo nadidevelop o nabibigyan ng importance is pulmonary rehabilitation. Though sad to say, medyo limited pa or konti pa lang hospital natin ang may pulmonary rehabilitation because dito, sa aming mga respiratory therapies na lagi na siyang tumatao sa mga pulmonary rehab, ando namin ma-emphasis namin yung education kung paano kikilos ang isang pasyente with emphysema. Okay? Yung mga exercises na gagawin para ma-minimize yung shortness of breath.
Okay. Now, Dr. Lenny, is surgery an option for people with emphysema, especially those in the latter stages?
Yes, we have done it. It's quite counterintuitive because you have a destroyed lung and you're operating on it. Now, the mechanism there is to remove some parts of the destroyed lung so that the other normal parts of the lungs can now expand and take over, and it will help now the efficiency of our lung movement. So we call it lung volume reduction surgery.
Now, there's a support group in the Philippines for patients with emphysema as well as bronchitis. The program aims to relieve a patient's symptoms. Mr. Noel, please tell us more about this group.
Ang alam ko lang dito sa Pilipinas na may particular group is yung COPD group ng Lung Center of the Philippines, in which ginaguide nila yung mga pasyente and especially towards awareness and education. Sa aking palagay, I think Dr. Lenny will agree, education and awareness is the most important thing to do para sa mga pasyente natin na may emphysema at sa mga pamilya nila.
That's right. I think education is very important as well as what to do, especially understanding the disease. But my question for Dr. Lenny is, how prevalent is emphysema, especially here in the Philippines? Has there been any recent medical breakthroughs in treating the disease, especially in your practice?
Yeah, so around 20% among adult Filipinos actually have COPD. So that's the persistent obstruction of the airways. Now, any breakthrough so far, actually, it would be in the medications because the medications are very good right now in terms of sustaining the opening of the airways so that patients would feel less short of breath. And we are also trying to make our pulmonary rehabilitation programs more aggressive because the breathing techniques that we teach our patients and how they would now perform their exercise on a daily basis can have a big help to them in terms of lessening also their shortness of breath. Otherwise, still, as you mentioned, it would be prevention is better than cure because once it's really there, unfortunately, there would still be no decrease or in terms of the medications in lessening the destruction in our air sacs.
We wrap up another interesting episode today. We'd like to thank our guests, registered respiratory therapist Mr. Noel Tiburcio and pulmonologist Dr. Lenora Canizares Fernandez. We appreciate your time and your effort. Emphysema is irreversible, but it can be prevented. And since smoking causes most cases, the best way to avoid it is to not smoke. So for smokers, stop smoking. Remember, once damage to your lungs has progressed to emphysema, it cannot be reversed. You can only make changes to slow down the damage or stop it from getting worse. It's never too late to start a healthy lifestyle. The choice is yours. I'm Dr. Freddy Gomez, helping build a healthier future for you. Thank you for watching MedTalk Health Talk on CNN Philippines.